Welcome to Business Innovators Radio, featuring industry influencers and trendsetters sharing proven strategies to help you build a better life right now.
Welcome back to the show, everybody. We are super excited here today. We have Dr. Wells, who is a chiropractic physician, and he's an expert in knee pain, shoulder pain, and spine adjustments. And I want to welcome you to the show, Dr. Wells.
Well, thanks for having me. It's a nice early morning.
Absolutely. I appreciate you spending the time with our audience today. So let's just jump right into it. Tell us a little bit about your business and the types of patients that you're helping.
Yeah, well, I've been in business for longer than I can imagine. I graduated in 1997 from the National University of Health Science in Lombard, Illinois. I did my pre-med at the University of Utah there, and then I graduated in 1997, and I've been in private practice here ever since. I opened up this practice in the northern Illinois area some time ago, and been helping patients here, and I actually specialize in a variety of things, but I've really focused in on sports and sports injury and spine. So we treat all kinds of patients. We've had professional athletes in my office, some Chicago Bears players, we work with triathlon and Ironman and all those kind of things. But then we work with the average Joe as well. So it really kind of is a broad spectrum of patients that I see.
That's fantastic. So when you treat somebody that comes in for a sports injury, whether it's an NFL pro player or, like you say, your average Joe, what are the kinds of things that you're seeing happening, and how do you see them responding to your treatments?
Yeah, that's a great question. They all respond fairly well. I mean, very well. We obviously treat back conditions in our office. Oftentimes when you think of chiropractor, you think of back, and that's true. We treat a lot of spinal conditions in our office. But what a lot of people don't realize is that spinal conditions can actually cause other conditions, such as knee pain, and I know that's something we're going to cover in maybe another day. But I get a lot of athletes that come in here with a knee problem that didn't know that there was a spinal component there that was actually aggravating that knee. So we see that oftentimes also too in the elderly population. People with chronic knee pain can have a problem in the lower lumbar spine that's actually causing an issue with the nerves that go to the knee. And so the knee is not stable, and the muscles that surround and protect the knee are weak. And so we're able to find those things. So we do a lot of that in this office. So
that's fantastic. It's amazing how intricate the body is and how so many things are interconnected together, where one thing really can affect not just other parts of the body, but it's just like a chain reaction thing. So that's excellent. Thank you for sharing that. And so what led you into the field? What got you started being a chiropractor?
Yeah, that's great. I kind of led right into that. I actually was an athlete myself, and I was in the martial arts for my whole life. And I was actually testing for black belt in karate. And so I was at the University of Utah and competing, and I actually hurt myself in a match. And so I couldn't turn my neck. I injured my cervical spine. And so my buddy, his name was Terry, and he said, "Hey, you got to come visit my chiropractor." And I'm like, "What's a chiropractor?" I remember there was a chiropractor. I'm from Ohio. There was a guy in town, but I just knew he had an office. I'd never stopped by, and I didn't really even know what that word meant. So I gave it a shot. I walked in, and he set me down, and he went through a thorough consultation and an examination, like you would expect any doctor to do. And then he showed me my problem, and then he started correcting it. And really within just a few visits, I felt dramatic relief. But what came later, in about a few months, is that I had a pretty serious illness that I grew up with, asthma, and pretty extreme asthma, and sports-induced asthma. To the extent that it put me on the sidelines. I literally would miss school for 2 to 3 weeks at a time. and would have to be rushed to the hospital when I was even younger. So I was on pretty serious medications and things to treat that, even in my 20s, even at this point when I hurt my neck. And those medications had a side effect. They kept me up at night was one of the major side effects, and frequent urination. So I was up running to the bathroom, and I didn't get the best sleep. And so long story short, my asthma improved tremendously, and I couldn't understand the connection until later, until this man set me down again, and he had workshops, and he would explain to me the neurological connection between the spine and the nervous system and the organs of the body. And that changed the course of really my life, because I was going into medicine at the time. But I started to look at this other alternative health care and take it seriously, because it had seriously impacted, my health. So that's kind of what got me involved,
That's a very personal story. I mean, you had something that was life-changing, and you turned that into your mission in life, which is phenomenal. And I always ask, doctors and entrepreneurs and physicians, is there someone who inspired them along the way? And it sounds like this is the physician that actually inspired you to become a chiropractor yourself. Yeah,
till this day, he's still a physician. He's an amazing chiropractor. He's a holistic healer, kind of a guru, if you will. He's definitely highly regarded in my profession. So I'm really grateful to him to this day for the role that he played, for his skill, and really for taking the time to sit down with me. And he would have workshops where he would have patients come in, and he would go through, the power that heals the body, the power that made the body heals the body. Without the nervous system, we don't function, right? And so for us to live, we have to have a healthy and intact nervous system. And so I started to understand that there's a very intimate relationship between the spine and its health and the nervous system and the health of the individual. And so we take a very holistic approach here at my office, but we also blend, that holistic approach with a traditional orthopedic and westernized approach as well. So we kind of blend the two. And I think when you do that, when you look outside the box, you get better results that way. And I think that's what patients are starting to seek today. They're looking for, maybe non-drug alternative solutions to some of the problems that they're, dealing with today, especially chronic disease.
Absolutely. No, I see that. So what would you say is one of the biggest misconceptions that people have out there in chiropractic?
About chiropractors, or just the chiropractic model?
Yeah, in general. What are some of the things that you see out there that you could help maybe clarify for some of our listeners today?
I think one of the main things I didn't realize, I didn't understand, I guess I didn't know much about chiropractors, but their education, their background. So chiropractors have to go to med school, which is the same curriculum of a medical doctor. So, the actual medical training is quite extensive. And so, if you compare the actual hours, it's very comparable. We have more anatomy and physiology, maybe even some biochemistry, where they spend more time in pharmacology and focusing on pathology. And so, but when we graduate from our medical training, it's comparable to that of a medical doctor. Then our medical colleagues go on and they do, they go in and did certain, programs and residencies, and we go off and set up a practice. And most chiropractors, though, they have postgraduate education in something, whether it's rehab or neurology. But I think that's a misconception, I think, of a lot of people. I hear all the time, not all the time, it's not as much as it used to be, but, patients will say, well, my real doctor, says this and this. And so I think a lot of people don't realize the scope of a chiropractor's background and what they're able to do. So as chiropractors, we're licensed physicians in all 50 states. The only thing that we don't do is prescribe or cut. I guess some states you can suture, but I don't like blood, so no suturing here, but
I know the feeling. My father was what you would call one of those real doctors, quote unquote, and I skipped biology class because I'm like, I'm not doing blood, I'm not cutting up a dead frog, I'm not doing any of that stuff. Forget that.
I mean,
I understand completely where you're coming from.
Yeah, I literally, not to gross your listeners out, but when I was 4 years old, I cut my finger off. Isn't that terrible? I can't imagine. I have 4 kids, and if one of my children, I would freak out, become a spaz, and my wife would have to take care of the situation. But yeah, I mean, so that trauma of seeing all that blood. So I kind of knew early on that I didn't like blood, and I'm in pre-med at the University of Utah, and I never really enjoyed being in a hospital setting. I think God had a plan here, so I found my my purpose, and it's pretty cool when you can do that.
That's awesome. That's great passion. Your patients obviously appreciate that passion, and you helping them in what you do on your day-to-day basis. So can you describe a situation where you've actually helped one of your patients overcome a challenge or, set them up for success in a way that they hadn't before they came and saw you?
Sure. Yeah. I mean, you know what? I'll break a, I think this is a misconception. I see it all the time. Why in the world would a chiropractor need to or want to treat a child, right? What kind of a pain or a problem would bring a child to a chiropractor's office or table? So let me tell you of a lady who came in with her son. He was 6, and his name's Spencer, and he had chronic, debilitating constipation. This poor little fella, he only went to the bathroom maybe twice a week.
Wow.
That's serious. And so he was on serious medication for that problem. And so the medication treated the symptoms of what? His constipation, his problem. But what was the underlying cause? What was causing this little guy's problem? And so this mother kind of had some understanding and some background already. She understood the principle of chiropractic, and she had moved, and she had moved to this area. And so she saw that I was a chiropractor in the area and had a patient refer her to me. And so she came in, and I did a really thorough neurological assessment of this little boy. And what I did is I found in his lower lumbar spine some areas that were in what chiropractors call subluxation. To the layperson, it just means that the spine, when it's not in the right correct position, it actually pulls on or pinches the nerves that come out of the spine. So, think of having a guitar or a piano. I mean, if you've ever sat down at a piano or played a guitar, when it's in tune or not in tune, right? And so what do? They change the pitch by tweaking the wire, right? So this little fella had some problems affecting his wires that went to his colon, causing that colon not to be at the right pitch. Not to get the right input from the nervous system. And so we found a little issue there, and we started to adjust his spine, and it took pressure off those nerves so that it could get the right information, right? And so that little boy started going to the bathroom. Really within visits, he was able to go to the bathroom every day. And, that impacted that little fella's life. If you think about it, if you cut the nerves that go to the colon, what's going to happen to the colon?
It's not going to function.
It's going to cease to function, right? That's a dramatic experience or an example. But if you pinch that nerve, if you shut it down, maybe say by 50%, what's going to happen? It's going to affect. It's only
going to work partially. Yeah. That makes total sense. Absolutely.
Right? So here's the thing: you don't feel it generally, so you don't necessarily feel a pinched nerve to the colon. And that's the problem with a lot of people here today in America, is that we think we're healthy if we feel good or look good.
Right.
Let me repeat that. This is so important for your listeners. Most people base their health on what? How they look or how they feel. But really, that's risky behavior, because if you do that, you're going to miss the top 3 killers in America today. Because number 3 is what? It's heart disease.
Right.
And, 80% of the people who have heart disease, the first symptom is death.
That's pretty scary.
And then cancer is number 2. And, you can look at Patrick Swayze, or you look at some of the people like Farrah Fawcett who had, unfortunately, this disease affect them, but they didn't find that out until they had symptoms.
Until it's too
if you
late,
talk to doctors, the disease process had been building up 10 to 20 to 30 years, right? But there were no symptoms. Anyway, that's a great example of a little guy coming into the office without the symptom of pain, but he had a symptom of constipation.
Well, he had a major issue going on. Absolutely.
Had a major issue, right?
Yeah.
So I think the thing that I love the most about what I do is we're trying to always look at the cause and not just look at the symptoms. But understanding symptoms are gifts, and you've got to appreciate the gift because it's a warning signal. It's letting you know there's something. Yeah.
Absolutely, man. It is like your body's little alarm warning system, and you're going to finding the cause helps you eliminate that, which is fantastic. That's perfect. That's exactly what I was looking for. So thank you. So let me ask you a question. What should be the first thing that a listener should do if they really want to improve their health? Maybe they've got some issues that they're having a challenge solving, or they just want to take their health to the next level. What would they do to start the process?
It goes back to that. It goes back, Marcus. It goes back to that principle. Thomas Edison, right? Pretty smart dude.
Yeah.
And he said this back in his day. He said, "Look to the spine for health and disease." It's a challenge, I think, for some people to say, "Hey, why would I want to look to the spine?" But that's really the number one place to look. Even the father of medicine, we look at our medical model, which is allopathic. But back in the day with Hippocrates, the father of medicine, he said the same thing as Thomas Edison said, that we really should always look to the spine for health and disease. And Thomas Edison went further. He said, the doctor of the future will not only interest his patient, in nutrition, but he'll look to the spine. And so I would always say that the number one place to start would be to assess, the spine and to assess the neurological function of every patient. And that's where we always start. That's kind of like the foundation. And then we kind of build off that and go from there.
Excellent. Excellent. So perfect. Where can they find more information, or how can they contact you or your office?
Well, right now, we're in the process of actually changing our name. We're creating a new website, but right now we have a website called drwellsclinic.com. You can go there, drwellsclinic.com.
Excellent. And if they wanted to call your office and make an appointment, how would they do that?
Yeah, they can call. Just ask for Shelby. She'll answer, and it's 847-245-3202. And we're open Monday through Thursday from 9 o'clock till 12, and then back at 3 to 6. And we're really easy, pretty flexible here. You can go online, download the paperwork, have it filled out. We have forms in Spanish. We have forms for children, so you can bring that paperwork in. We really pride ourselves, though, on not keeping people waiting. Here's the thing, Marcus. I grew up in doctors' offices, because a young boy with asthma and being rushed to the ER and, being hospitalized. I understand the medical model, and, I'm so grateful for it because it saved my life many times. But it also sometimes keeps you waiting, right? When you go to the real doctor, right, you sit and you wait maybe sometimes for an hour. And so I said to myself, you know what? I'm not going to keep my patients waiting because I'm going to respect their time. And so that's one of the things we pride ourselves in is trying to give world-class service and not keeping patients waiting. So we're pretty usually on time.
That's brilliant. I love it. Well, thank you today for your time, Dr. Wells. You gave us a lot of golden nuggets for our listeners, so I really appreciate you being on the show today.
Well, thanks for having me. Appreciate it.
Absolutely. I'm sure, and I'd love to have you again. I know you do a lot of specialized things, so why don't we continue the show on our next interview? Okay, sounds good. All right. Well, thank you so much. I appreciate you being here. Well, there you have it, folks. It's been a wonderful show, and next time we'll have Dr. Wells on again, and you'll learn even more great nuggets of how to take your health to the next level. So that's our edition for our show today, and we will see you next time.
Thanks for listening to Business Innovators Radio. To hear all episodes featuring leading industry influencers and trendsetters, visit us online at businessinnovatorsradio.com today.